Documents obtained by Newshub show the country's biggest public health unit struggled during the Omicron outbreak, even when dealing with just 14 new daily cases.
The biggest issue was staff shortages at Auckland Regional Public Health, and there are concerns we won't cope with the next outbreak or variant hits. Investigations reporter Michael Morra has the story.
As Omicron emerged in the community, motorways were empty and testing sites filled up. But with only a handful of cases, Auckland Regional Public Health struggled with workforce shortages.
After 2 years, you'd expect to have some systems efficiencies in place. So I think it's actually very disconcerting.
Situation reports obtained by Newshub reveal that on January 24, with just 14 new daily cases, there were shortages of public health medicine specialists and a lack of administration staff was causing strain. By February the 2nd, with 104 new cases, critical roles were vacant, including operations and project management, and the ministry's Māori health-focused unit, Paiora, was thin on staffing and resources. When cases hit more than 12,000, there were capacity concerns with the Pacific team, and critical resource issues were noted with the resignation of an operations manager.
Are future outbreaks inevitable? Yes, they are. Are we likely to have new variants? Yes, we do. Can we have any confidence that our contact tracing will manage it? No, we can't.
But the Director-General is not concerned, saying contact tracing is handled nationally and the workload can be shared.
And that allows us to use public health units around the country, as well as a number of providers that we contract with directly.
To cope with the shortages, Public Health asked trainee doctors and medical students to help.
Why has the capacity to do contact tracing been consistently exaggerated?
The Prime Minister is adamant our response remains gold standard, saying we've done better than others.
This pandemic's been going for 2 years and New Zealand still stands amongst the best in the OECD in terms of our experience with this pandemic.
The key will be remaining the best in the midst of documents which show critical workforces are under significant stress. The Director of Auckland Regional Public Health, Dr. William Rayner, told Newshub there remains an ongoing national shortage of public health medicine specialists, but he says all of these situations and experiences will help with future plans as the pandemic response evolves. Michael Morra, Newshub.